Hi everybody, my name is Jennifer Rawlins. I'm a physical therapist at Breakthrough Physical Therapy in Sunnyvale, California, and I am the women's health specialist here at Breakthrough. Today I'd like to demonstrate for you a really basic abdominal exercise that I tend to give a lot of my patients immediately postpartum. As you probably know, having good abdominal strength throughout pregnancy and beyond can really help your recovery process very nicely, okay? While you're pregnant, those abdominal muscles get pretty stretched, and so we want to make sure they're in tip-top shape so that you have all the support that you need. Okay, so for this abdominal exercise, you'll want to be on your side. Make sure you do a good log roll technique to get onto your side. You'll take at least one pillow, put it between your legs. This helps keep your spine nice and aligned. If you're pregnant, especially if you're farther along in your pregnancy, your hips have gotten pretty wide. So you can take a towel, put it underneath the hip down here, or underneath the waist down here. That also is to maintain good spinal alignment. Also, if you're very far along in your pregnancy and your belly's gotten quite big, then you can take another towel and just put it underneath the belly to prevent any spinal torsion going on here. So this exercise is very static. There's not a lot of movement involved, but what you'll want to do is take your hand, find your hip bone right here, go just inside of the hip bone until you get to some of this soft tissue right here. And the goal is to activate this particular muscle that's called transverse abdominis, and it kind of wraps around your whole belly like so. So in order to activate it, I want you to envision that you're hugging your baby in towards your spine, into your body. You can also think of maybe a hook is attached to the inside of your belly button, kind of drawing that belly button inward towards your spine. Or if it helps, you can think of your working muscles to bring your two hip bones closer together. Whatever cue works for you in order to get a little bit of tone happening in the soft tissue here, and you'll feel the tissue get a little bit firmer. You're going to hold this contraction for about 5 seconds and try to breathe while you're doing this. That's probably about the hardest part. If you find that you're holding your breath while you're maintaining this contraction, I encourage you to count to 5 so that you're holding it for the desired amount of seconds, but also it kind of causes you to breathe. It's really helpful. Depending on your ability, you can do between 5 and 10 reps of these on either side. So make sure that once you're done with this side, roll over and do it on the other side too, okay? So it'll look something like this. Hugging my baby inwards, feel this tissue get nice and firm. 1, 2, 3, 4, 5, and relax. If you find that after a few reps you're like, I can't hold this anymore, then you're probably done for that side and you can flip over and do them on the other side. This is a great exercise to do for women who are concerned about developing or have already developed some diastasis recti. That's the stretching of the abdominal muscles between your classic six-pack abs right here. This is a great way to get started on the program to eventually have that totally closed and nice and strong. Please come and see us for some further exercises to make sure that your abdominal muscles, both during and postpartum, are nice and supportive for you.